This is Crystal Williams, and on this special episode of Beauty for Ashes, we're going to be speaking to Nadine Dzieketey. She is a physician assistant at the Prince George's Community Hospital. She's been on the front lines of this virus since the first case arrived here in PG County. She also has seen people get well, and she's also seen them pass away. We're going to hear from her as she discusses with us how the virus has affected those in the workplace, seeing it on a daily basis, as well as how she has to transition her mindset when she actually gets home from actually a day at the office where she is seeing this up close and personal. Please listen in and take advice from her and just do your part to help keep yourself safe as well as others by doing the precautions that are necessary. This virus is serious and we don't want anybody unnecessarily hurt. So unlike many of the states are now opening up, and it's more imperative that we do the social distancing, that we put on the mask, and we continue to wash our hands on a regular basis. I thank you so much for taking the time to listen, and I ask that you would just keep an open mind to that, what she is saying. Have a great one. Welcome to Beauty with Ashes. This is Crystal. Today's episode where we're speaking to Nadine. I'm gonna let her say her last name because I don't want to mess it up. And she is a worker at Prince George's Hospital, where she does physical therapy and some other things I'm pretty sure that she's accessible to. But she's going to talk to us today about the effects of COVID and how they are impacting her community, as far as in work community, as well as her home community. So thank you and welcome, Nadine.
Hi, Crystal. Thanks for having me.
Sure, no problem. So as I stated, today's conversation is going to be more just talking about how the COVID-19 virus is affecting those who are in the workplace, as far as in the hospital. You may not work with patients that's coming in the emergency room and all, but I'm pretty sure because of you physical therapy, you have to eventually maybe go to them maybe for some things or just be around those. So can you tell us a little bit about what you're seeing out there in the field when it comes down to the virus?
Describing it has been a bit of a challenge for me because as a physical therapist, we see patients everywhere in the hospital. We get orders for patients in the emergency room. We get orders for patients in OB, orders for ICU, up on the floors. But the whole structure of the hospital has changed over the last couple of months. So we have floors of patients with COVID-19. So we're challenged by having to mobilize them and their restrictions. It's a fairly new respiratory condition for us, so the patient's endurance is not what it normally is. Having to deal with a lot of, monitoring their vital signs and seeing how we can functionally get them moving to get them back to home, or sometimes being their rehab because they can't get into a rehab facility. But I think the biggest effect from the patient standpoint is that they can't have visitors. So a lot of them are alone. We end up being their support system. So at times that happens even before this. You might have people who don't have as much family or as many friends as some others, but now people are really alone. And our COVID-19 patients are scared. They're anxious, and you end up being a little bit more to them. My role is supervisory. So I manage the physical therapist there. I'm the coordinator for physical therapy. So I'm seeing a lot of changes in employees in general, doctors, nurses, respiratory therapists, the patient care technicians, the physical therapists, occupational therapists, speech language pathologists, even down to housekeeping and, environmental services and cafeteria. People are scared.
Sure.
let me ask you this. Can you tell us tell me how when it first initially happened, like what did you all see at the hospital when, I guess probably what we could say as early as March, or was it even earlier than that,
I say
that
like
you
the end
all,
of February.
in the February?
Probably like the end of February. I think we got our first patient or two.
Okay.
Um,
And how was y'all response at that time?
so COVID-19 is a new strain of a condition that's been around for years. We've had SARS, we've had the avian flu or the bird flu, we've had the swine flu, we've had different strains of conditions that are common to us. So like different strains of the flu. And now this is a different strain of SARS condition. So the difference with the COVID-19 is our contact precautions. So usually if you have a condition that can be spread a certain way, then the patients put on precautions. Some of them are contact, meaning that the patient, you can pass the condition by touch. Some of them are airborne, meaning that, the condition passes in the air. And some of them are droplet, meaning that the condition, if someone coughs in the air, then those droplets that are released into the air are fairly heavy. But once they're released, it's a high rate of infection. But once they fall, that the objects that they fall on are contaminated and can pass the condition. So the challenge is that our COVID-19 patients have all three precautions: contact precautions, airborne, and droplet. So we're having to wear a lot more gear than we've ever had to wear for any of our other patients. I'd probably say before this, maybe our TB patients were like our highest amount of gear up patients. Like you'd have to wear the N95 mask and your gowns and gloves. But these patients, we have to wear eye gear. So we're wearing shields, we're wearing glasses. Acquiring that much PPE or personal protective equipment for staffing at such large numbers. We've never had a condition where we've been everybody masked. So we've had challenges in obtaining enough PPE for all of the staff members and educating on putting the PPE on, taking it off. Restrictions on you can't really bring the patients out in the hallways. So you're working with them in the rooms. It's a lot. It's really a lot that we've had to learn.
Okay. And so once, so fast forwarding a little bit, so that was at the beginning of March, and then I'm pretty sure you all had to start changing even more so as you got more and more cases of it. So how did that, look at the hospital?
So for us, we would, in the beginning, you only have like one or two patients, a few patients, but the rate at which the numbers increased was amazing. So we went from having just a few patients to having a lot of patients, to having whole units full of these patients. So I would say that I'm actually pretty impressed at how our facility handled that. At being a part of University of Maryland, the medical system, a lot of changes are made throughout the medical system. So we're fairly new to the system, 2017. So we're also called Capital Region Health. So if you hear those names, are kind of interchangeable at this time because we're building a new hospital that's supposed to open up next year. But across the system, we went to having certain wards that are actually preset for these patients. So a lot of moving patients around, a lot of restructuring entry into the units, exit out of the units, setting up areas where we can actually put the PPE on, take it off to, limit any thoughts of contamination. So a lot of structural changes, a lot of procedural, a lot of education, and a lot of flexibility. I joked around today, I told one of the weekend staff members, they tell us to be flexible. Well, we're now all contortionists. So we're as flexible as we're gonna get.
Yeah, absolutely, absolutely. So tell me, the video is freezing, so I'm not sure how it's going to come out on recording, but let's just continue.
Okay.
So tell me, okay, so I'm, we get a lot of, actually, Nadine, hold on.
Okay.
Okay. So, being as though you all have been at greater exposure to the virus because more people coming in, how is the transition from leaving work to go home so that you're not taking those same germs or rather that virus home? How are you protecting your family from not being contaminated?
So again, that process has evolved. We've been educated on things that we need to do, like within our organization, but practically we've kind of worked out some little systems amongst ourselves. So I have a pair of shoes for work and a pair of shoes that I wear around the house and into and out of the car. So I keep my shoes in the car, and before I leave the parking lot, so I put my shoes on there. I head into the hospital, and when I come back, those shoes that I've worn are right where the gas pedal is, so I don't forget them. I switch my shoes out, put them back in the bag, and they never enter into my house. They kind of stay in the car. Um, we've had some employees that are changing their clothes before they come out, so they wear their scrubs, and then they're changing into a whole new set of garments coming out to drive home. People are lysoling down their seats. Wiping down their steering wheel. We wash our hands and sanitize our hands till we barely have skin anymore. Yeah, once we get into the house, my family already knows, don't come near me. Mom has to decontaminate herself. So I'm taking off clothes, people, washing things immediately, going straight into the shower. And then after I've done all that, then I'm safe to be seen.
Okay.
So currently
Okay.
I'm not, directly seeing any of these patients. So my risk is less, but, everyone's kind of taking those same precautions. Make sure it's safe because, sometimes you never know.
That's true. That's true. Okay. And then how's the morale of the staff? I mean, you like I say, you may be in one department, but I'm pretty sure you're interacting with the other staff members. How is the overall morale of the staff over at the hospital?
Um, we are surviving. Um, I can't necessarily say we're thriving, we're surviving.
Mm-hmm.
Some days are better than others. Sometimes you see staff members and they just don't look like themselves. We try to encourage each other. We have a lot of people, like I said earlier, that are scared, that are dealing with anxiety, that are um, tired. I remember I had a conversation with a nurse, excellent ICU nurse, even before this. I mean,
Mm-hmm.
I would have no concerns with her taking care of any of my family members. And I saw her and I just asked her, how are you doing? And she said that her face literally was breaking out from the mask. She did show me the pictures that you see on the internet are not made up. It really is happening. And it's not just lighter complected people. Everybody's face is breaking out. She told me that she had just completed her day 4 of working a 12-hour shift. So she's basically working for 48 hours, um, maybe in the COVID unit, maybe in another unit, and then she had a couple days off. So we're encouraging each other to take care of yourself when you're not at work. Um, Sometimes just as little thing as, what, you're doing a great job. I see how hard you're working really makes a difference for people. And then those little things that people in the community do for the staff members, and it doesn't have to have a face to it, really plays a part in kind of lifting the morale. We had some of the kids from church kind of do pictures, and I put some of the pictures up on the wall in the nurse's station and, nurse's break room. And I gave copies to other people, and I gave about 4 of them to one of the doctors. And she saw me today. That was about 3 weeks ago. She saw me and she was like, those pictures really lift my spirits when I come in here. Like just
Oh,
seeing them
good.
really encouraging. So sometimes it's the little things.
Yeah.
We're all in this together. We really are.
Absolutely, absolutely. I definitely feel that we definitely here together because you get a chance to see all the different things that you're seeing around the world through the news. But the truth of the matter is that you need to know what's going on in your own community, and the hospital is really close to where I live. So I would like to know, if there's something we can do to support our first responders in that case, the hospital. Then we want to make sure we get that word out, as far as in the little things, the notes, the cards, the I don't know if you all had experienced the drive-bys where people in a parade and just beeping the horn, but
Yeah.
I've seen that. I thought that was great. So I want to make sure that we're supporting our community as best as we can until they move, because the hospital is scheduled to move. Okay.
Yeah.
And everything. So I know that you also said that you got donations about the mask. How effective are the masks? Tell us about the donation first of all, and then tell us how the the masks that are being brought in from the outside, how they're being utilized.
Okay. So so far I've gotten two sets of donations of masks. Miss Elma Brandon, she from our church, she made some. They were beautiful masks. I think I might have one in my purse so I could show you, but I sent you a couple pictures. When I got them, they were all white, nicely pleated. She ironed them. She told me she washed them, ironed them, has a little pocket in the bottom with a filter, put a little note on them. I joked around. I was like, did she pray over these before she actually made them? Because they look so delicate. And the response was just amazing. I went around to some of my, coworkers, gave them out. I went up to the nurse's station, gave them out, and one of the responses was like, wow, this is really what the church should be like. This is what Christ would be like when you do things for people that you don't really know. So it's not a matter of, okay, this is like a surgical mask. We understand it's not. We're a fully masked facility, so you have to wear a mask at all times, not just in patient care, just period. You have to wear a mask coming into the hospital, going out. Some people don't have time to actually buy masks that aren't surgical. We only have a limited supply in the hospital. The fact that someone thought to make these, I got a set today, they were all different colors, and people were just excited that, there's something, a print on them. It was softer than the ones you have to wear. Like, they didn't tug on your ears as much, or, just little things like that. So it was really nice to have it's really the thought that someone considered you. And some of the masks that I got today, uh, Prince George's County has been really hit hard by the COVID-19 virus. Our numbers are pretty high. And so the hospital's numbers in the area are pretty high. And some of our population, they're all different economical and socioeconomical levels. Some people just don't have the means to, make or buy a mask. And some of our population are elderly. So if we're getting patients coming in from the nursing homes or who live by themselves in a senior facility, they're already afraid to go out and they have to wear a mask when they do. Having a mask that's given to them by someone in the hospital is actually, a token, a really kind gesture. So we do have some that we're giving the patients that are being discharged, and we don't have a lot, but the few that we can give out makes them happy. I gave one to a patient today, young man in a bed by himself. I saw him yesterday and I came by. I was like, hey, do you have a mask? I have one somewhere. I was like, I think this gray one would look nice on you. I just gave it to him, and I asked him if anything else. It was a smile. Being alone in the hospital after surgery and you're scared, it means a lot.
Yeah, absolutely. If people wanted to do donations to Prince George's Community Hospital, tell us how can we get those supplies over to your organization?
So our main number is 301-618-2000. Probably asking for patient relations if you wanted to do something like for the patient, or if you wanted to do something for the actual staff members, our marketing department might be a good place to start, or even inquiring at, information, like they'll give you the information as to contact people. Right now, a lot of people are just doing things by people they know who work there, and it kind of gets in and, they direct it to the right person. If it's something bigger than just like small tokens, some things have to be approved because they just can't go in without proper approval, like, giving machinery or something like that. Like, you can't just come and donate, like, N95s. They have to go through a process. But if it's a small gesture, then yeah, we can take that.
Okay. Well, tell us this, and one last thing, and basically, how you doing?
How am I doing? Every day is a different challenge. I am learning a lot about myself, as everybody else is. The challenge to homeschool and work. I don't think those both are supposed to go together, but we're learning.
Right.
You know, my husband's working from home, and then my daughter, you know, she's in college and she's also home, so we're all kind of helping each other. But I think the biggest thing has been that we've spent more time together as a family, and it allows you to really remember the little things, the things that are important when you're so busy scurrying around and you can't do that anymore. They're, you
Yeah.
know, my kids play sports, there are no sports. So we come home and
Mhm.
they're like, ah, yes, Uno. It gets crazy out
Yeah.
there, you know? Nerf wars in the
Yeah.
house. Good
Yeah.
stress relief. So
Oh,
we're doing
yeah. Great, great. Well, I just want to thank you once again for one being on the front line, but two, more importantly, just talking about it so people will know exactly how and what we can do to support you guys because we really appreciate everything you're doing. So once again, just thank you for your time today, and hopefully this will be behind us soon.
hopefully, but if not, thank you, Crystal, for having me and interviewing me. I'm not sure how much of a picture I place, but you know, I really want to encourage people to be patient with the stay-at-home orders and to be compliant with just going out when you really need to. It may not seem like a big thing, but we do have a lot of vulnerable adults that are outside. You don't know who has asthma or who might be the one that's really suffering. All of the patients that we're seeing are not elderly. We do have
Right.
patients in their 20s, in their 30s, in their 40s, 50s, all the way up that are really struggling with this condition. And then we have some that are in their 70s and 80s that kind of do well. So, you know, it's kind of a catch-22, but the more we can control the numbers and really prepare to take care of the ones that are really are ill, then it helps the community and then hopefully we'll get back out sooner. So, you know, be impatient. And thank you, Crystal, for having me.
Thank you.